Welcome to 21st Century Health. I'm Jackie Bales. Many believe there's a trade-off between the cost of health care and the quality of care. But the truth is, while America's health care cost is the highest in the world, studies show we are not at the top in quality. We're about to meet a man who says a big part of the solution lies in streamlining health information technology to create more coordinated and efficient care. Joining us is Joseph Casper, CEO of Sandlot Solutions. Welcome, Joe.
Thank you, Jackie, and it's a pleasure to be here.
Joe, I know you've testified in government hearings and that you're named as an expert in a report to the president on revolutionizing healthcare through information technology. So, to what do you attribute this situation of high healthcare costs without commensurate quality? What's been going on?
Well, we've heard a lot about these costs. There's some $2.6 trillion, which represents about $8,400 per patient. What you haven't heard a lot about is the top 5% of those patients represent 49% of the cost, and the top 20% represent 81% of the cost. These are patients that have a lot of illnesses. These are patients that have a lot of transitions in care, moving from the hospital into rehab, moving from primary care to specialist after specialist. And part of the problem is the information does not follow the patient. There's no access to that. Transitions in care are difficult, and the information simply is not available.
They're not on the same page. Tell us who Sandlot Solutions is and how you help solve this challenge.
Sure. Sandlot is a software solutions provider that deals with these transitions in care. Sandlot has technology that allows you to extract information out of hospital systems, to pull it out of physicians' electronic medical records, to be able to aggregate that data and to assemble it and provide it to the physician at the point of care. It also has the ability to alert them when there are gaps in care and remind them to avoid redundant testing.
Joe, you say these systems improve quality. Can you tell me more on how Sandlot Solutions does this?
Sure, but by gathering the data up and making that data available at the point of care, right within the physician's workflow, allowing you to see when there are tests or being alerted that a particular test hasn't been completed, allowing you to run analytics on that information so that you can identify where specific care is needed. The more data you have, the better the decision, and that's what Sandlot does.
How does the information get from the one doctor's office or the one rehab facility? How does it get aggregated if, they're all able to still use their own legacy systems? This is amazing to me.
This is a great question. This is precisely what we do. Well, what we have is the ability to take that data from whatever that system is, regardless of how those silos are built, and to extract that data out, put it into repositories that have access to the information to aggregate it up again and push it on to the next solution. Of course, we're benefiting by the kind of transition to standards. So there are more and more standards being adopted here to do that. But this is tough work. This is one of the toughest parts of healthcare, to be able to get hospital information out, make it available to physician, take information from primary care and move it to specialists, take it from specialists and transition it to the hospital. All that is what Sandlot does.
Well, let's take a closer look at the advantages of using information technology to its fullest in this 21st Century Health Field Report.
Without technology, it can be difficult, if not impossible, to get a complete patient medical record at the point of care. The healthcare industry is faced with duplication of services, including tests and procedures, out-of-control healthcare costs, hard-to-deliver evidence-based care, and patient satisfaction is not commensurate with the cost.
This is a new model. It presents new challenges. And we found very early on, in looking at the data and looking at our patient population, that Sandlot was extremely important in providing the appropriate analysis of these patients and getting the information we need to provide their care. In addition, the metrics and the digital envelope technology adds even further on our ability to measure the quality of care we're delivering and to make sure it is also cost efficient. The delivery of value in healthcare is the future, and Sandlot is going to be part of that future. With the evolution of the ACO, the future is right now.
Sandlot Solutions has developed a suite of products designed by physicians to address these issues. It is a cloud-based health information technology platform that provides near real-time comprehensive patient data and decision support tools for physicians at the point of care.
Yeah, we have a product called Metrics. Together with another product we have called Measure Builder. We could build any measure or clinical indicator based on any demographic or clinical data and send the results of those measures to the physician via a digital envelope. Cloud computing has a lot of advantages. One of the biggest advantages is called resource pooling or sharing of hardware across systems or the consumer base. So as a way of reducing our costs and ultimately our costs to our consumers, we're sharing a lot of hardware.
Sandlot Solutions configurable technology streamlines data sharing across sources and formats. Clinicians receive a digital envelope within their normal workflow with relevant patient information and analytics, including prompts for appropriate interventions, education, and follow-up. The result? Improved patient outcomes and reduced cost of care. As a recognized leader in health information technology, Sandlot Solutions provides tools that improve patient outcomes and reduce the cost of care by streamlining and sharing information between providers, hospitals, and insurers. Whether you are a hospital, physician, accountable care organization, state, insurer, or employer, Sandlot Solutions has the solution that's right for you.
Joe, with all the changes that are occurring in healthcare now, what do you think will be the change that will have the most impact?
Sure. The change likely to have the most impact are the change in the healthcare models. And this is the change from fee for service to pay for performance. When pay for performance occurs, you shift who's responsible for the quality of care, making physicians accountable for the quality of care as well as the outcomes.
So not just on the number of office visits then, the outcome.
Correct.
You mentioned getting patient data from lots of different sources. Is that really possible?
Sure, it's possible. In fact, Sandlot's been doing it for more than 5 years. There are technology standards that are evolving. Our technology has the capability of pulling system data out of hospitals, out of physician electronic medical records, directly from national laboratories, and assembling that data all together and making it available at the point of care. So yes, it's definitely possible.
What about compatibility with health organizations' legacy systems? How do you address that?
Well, they're a challenge, and there'll always be a challenge, but there is, again, technology. Sandlot has the technology to be able to reach inside those systems. We're seeing changes in the standards that are helping us, but the ability to reach inside and take those messages out, assemble that data, it's a little trickier, but we have technology capable of dealing with legacy systems as well as the current EHR systems that are being deployed.
Joe, you talk about Sandlot doing this for 5 years now. You know, speaking personally, my mother, when she passed away, had many complex conditions, many physicians, and it was a nightmare. No one was on the same page. No one seemed to have the same information. If you've been doing this for 5 years, why are there still so many offices that are, you know, just not using this kind of service yet?
Sure. Well, first of all, in the United States, there's been a tremendous uplift in the use of electronic medical records. Physicians have moved to be able to deploy these as specialists. Hospitals have spent hundreds of millions of dollars to create electronic systems. But again, still, these systems did not talk to each other. Sandlot has built capabilities to allow us to take the information. So as your mother would transition from the hospital back to her primary care, one would make sure that the information was readily available. Those discharge notes were made available to the primary care physician. But more importantly, that as the information was assembled, it would follow your mother as she moved from primary care onto the specialist, off to rehab, and making that available at the point in time that the provider needed it. At the same time, looking back and firing alerts to physicians to remind them where there are gaps in care.
Sounds like that system would have been much needed because it felt like it was me that was transferring the information. Joe, with the recent and ongoing concerns about hacking and privacy and security, what about those? What assurances can you give someone that the systems are safe with regard to privacy?
But security and privacy are of the utmost concern. And in order to make sure that this is protected, data must be encrypted when it's sitting and when it's stored, when it's transported. So at any point in time that data is moving or being stored anywhere, that data must be encrypted. And of course we do that. The other part of this is patients have the ability to opt into these systems. So the patients have some say.
Oh, okay. So can they opt in a little bit or just share some of it, or how do they do that?
Much of this is actually controlled by state regulation. So in certain states, you have the ability to say, I'm going to opt into the whole system. In other states, you can say, I want to opt in at this facility or at this facility. We tend to practice and encourage folks that it's the continuity of care that we're trying to deal with. And so the ability to be able to make that information available to any caregiver. And so these are highly secure. They're made available to folks who are providing care in your continuum of care. And so it's important that they have access to your previous medications, to your previous laboratory, and to help drive the cost down rather than duplicate that test when you move from one location to another. The information follows you, and a $1,000 CAT scan is not repeated as you move from one facility to the next.
So Joe, overall, what do you see happening in the future of healthcare IT, and how does Sandlot fit into that picture?
Well, I think we're going to continue to see more and more adoption. So there'll be more physicians in rural areas that have chosen to move to electronic medical records. We will see entities combining data together so that they can begin to share it. And we will see more and more use of analytics. You know, the computer is a very powerful thing, capable of sorting out an awful lot. And you think of a physician sitting there trying to figure out, have you had this test, or have you had this test, or have you had this test? When the computer can just scan across, take a look and see if I see a result from a laboratory and I know you've had the test, or I can look at, have I paid for that, and know from the claims data if I've had that. But trying to bring it all together and do that in real time is really where healthcare is headed in terms of information technology.
Well, Joe, you have put an enormous amount of thought into the ways that today's information technology can improve healthcare and save money. I'd like to thank you for sharing your knowledge and your solutions with us.
Thank you. Pleasure to be here.
And thank you for watching. For 21st Century Health, I'm Jackie Bales.